Hey, beautiful soul. This is the Menopause Coach Podcast with me, your host, Adele Johnston, the Menopause Coach and Educator, International Menopause Certification founder and Psychology Master. And I am your mentor for the next 20 minutes or so together because you and I, we are making women's health and menopause mainstream. Now, for years, the conversation around weight and midlife women in particular has been so frustratingly simplified. The calories in and calories out. Yeah, that whole just move more and eat less if you want to lose weight. It does not work and it does not float with us. Yeah, we know that it's not that simple. Women in perimenopause and in menopause have a lot of change happening and the body composition that changes. Yeah, more increased body fat, visceral fat, reduced insulin sensitivity, rising inflammation and brain fog. And suddenly the strategies that once worked are no longer working. Now, at the same time, GLP-1 medications have entered the public conversation. And they're often framed around things like rapid weight loss or appetite suppression. But the story is far more than that. GLP-1 receptor agonists are phenomenal for so many different things. And together, you and I, we're going to get to speak about this in detail today in this episode. We're exploring the intersection between receptor agonists like GLP-1s and the bigger picture with obesity. So, I'm joined by Dr Rocio Salas-Whalen, a board-certified in obesity medicine and fellowship-trained in endocrinology specialist within diabetes and metabolism. She's the author of national best-selling book Weightless and one of the earliest adopters, a trailblazer in this space of GLP-1 therapies in clinical practice. Her work reframes obesity, not as a personal failing, but as a complex metabolic condition that deserves precision and compassion combined. She's a powerful voice in this space, and it's an absolute pleasure that I have this conversation today. So enjoy this episode. Now, before we begin, please do remember that this episode and all other episodes are for educational purposes only. They're not intended to replace any individual medical advice. Always consult your own healthcare provider before you decide on any medical treatment.
Thank you so much for inviting me. I think we're going to have great points to talk about today.
I don't think they'll be long enough, but we're going to see what we can fit in to the time that we have today. So I am well known within the podcast space right now for we just dive straight into topics.
Okay.
All right. And I think that when you and I connected, something across the social platform where I'd been really consuming all of your Instagram page updates, all the podcasts that you've done so far, I have been absolutely loving reading your book, Weightless. It has been I've bookmarked it, you can see it here, but it's been such an eye-opener for me as a menopause coach and educator in the space to be able to understand from, someone of your level of expertise and knowledge and actually a trailblazer in the space of not just obesity and medicated weight loss, but as you're starting to think wider and deeper in the space of what this medication can really do to help. So that's where we're going to take this today, right? And just really starting to understand how we as practitioners can support women and people. Obviously, my focus is on women, but people around this world to live happy, healthy life.
Exactly.
So before we get stuck into some of the questions that I'm absolutely eager to ask you, I would love to just find out a little bit more about why you have really gone into spearheading the change within this space, because it's a real big area to kind of jump right into. So I'm just curious, why GLP-1?
When I was in residency in 2005, I was an intern in internal medicine here in New York. We had a speaker for our weekly talks. And the speaker was Dr. John Eng, and he's the one that isolated the GLP-1 from a Gila monster, from a lizard. And he's the one that had the first GLP-1 in the market, exenatide. It was called Byetta by then. And I remember him giving this talk about this new medication. And I remember just like something light up on me. And I said, this is what's going to change our health. Mm-hmm. I saw the potential of this drug from day one. And 2010, when I completed my residency, my fellowship, I started prescribing it and recommended it to my patients and using it on my patients. So I very early saw the benefits in the patients with the medication. And then I've been prescribing ever since then. And I've seen through time what works, what doesn't work. I do body compositions on every single patient. So I've been able to really pinpoint how to get a patient to the right body recomposition, because at the end of this journey, what I'm looking for my patients is body recomposition.
It's amazing the influence that people around us can have. And that one moment in your medical career really transformed your pathway. I mean, not by chance, right? This was always your purpose path for sure.
Yeah, for sure.
Yeah. Yeah. So with that in mind then, GLP-1, we're not going to go into explaining exactly what that is in this episode, because I feel like most people that are following along in this space know what it stands for, roughly what it does in the body. I would love for us, you and I, to jump more into the menopause, the midlife woman conversation. Being a midlife menopause woman myself and having gone into early menopause. Yeah. It's like, actually, it does change a lot. And although there are still some people out there that, you know, and I'm very upfront with this, that I feel it a bit narrow-minded with menopausal women. We're not all the same. We don't all need the same approach. Mm-hmm. It's very individualized, but I'm really keen to understand around the criteria for GLP-1 prescribing is very strict, isn't it? It's very clear.
It's written, right? I mean, that's what health insurance follows here in America and what the guidelines tell us. But the problem with following the guidelines is that they're based on a BMI, right? On the body mass index. And we've known for years that the BMI is not the best way that reflects people's health, right? Because it's just a calculation between your height and your body weight, but it doesn't tell us what's what in your weight, right? What's your visceral fat? What's your percentage body fat? What's your muscle mass? It's just a combination of everything, bone, muscle, organs, blood, water, when you're taking the BMI into account. So I've seen through my patients, by doing body compositions, that many patients who may have a normal BMI, they will benefit from the medication, because what's giving them a normal BMI is just a ratio, right? It doesn't give us the division between body fat and muscle. So many patients with a normal BMI are what we call skinny fat or sarcopenic obesity, that, it's a low BMI because they don't have muscle mass, but they have high body fat. So those patients can potentially still benefit from a GLP-1. So if we use the BMI as our only indicator on who can use this medication, we're missing more patients than not. That's the problem with the BMI. So what I do in my clinic, I step away from the BMI and I do body composition. So I look at the visceral fat, I look at the percentage body fat, I look at the muscle mass, and that's what makes me decide which patient can benefit from a GLP-1.
So I love that you've said that, because again, when I think about the majority of conversations that I have in practice with women, they will come and they will say, I've tried everything. Like, I am really trying hard. You know, I'm doing my steps for health every day. I'm working out. I'm really watching what I'm eating. I've cut back on the things I've been doing in the past, and nothing's moving, nothing's changing. And even the hip to waist ratio markers that we can bring in to look at health marker points as well, are really giving them cause for concern. They're not seeing a lot of adipose tissue loss around the stomach area. That's something personally, even for myself, that I've recognized around my tummy areas where I hold a lot of my own belly fat since menopause. And I think that what's quite intriguing in all of this is understanding what you've just shared there is can we maybe start to see in the future, whether it be now, whether it be in months or years to come, that actually if we move away more from just the BMI and we look at the actual woman, whether that be your patient, whether that be, just a woman standing in front of you saying, please help me, do you believe then that GLP-1s could be a support in menopause care, regardless of BMI?
And I see this in my practice too. I see the woman that is coming to me. I'm doing everything that I used to do before and more. Right? Women are even adding more workouts, eating less, trying to get the same results that they didn't before. And it's just not happening. And in midlife is a period in a woman's life that many things are happening at the same time. That is very different from your 20s and your 30s, right? We have external things that are changing in our life that can affect our weight. And then we have internal changes that also can affect or promote weight gain. In the external parts, so in midlife, we have aging parents or the death of a parent, a divorce, growing kids, or professionally, we're in our peak. So all of that can influence or promote weight gain as stress, or if we're not sleeping well. If you're going through perimenopause or menopause, your sleep is probably going to be disrupted. You're feeling tired because you're not sleeping. Then you're feeling tired and not want to exercise more or eat healthy because you're still not sleeping well, right? So sleep is basic human necessity for everything else to work better, right? And then we go into the hormonal changes. We call it the chaos, the hormonal chaos during perimenopause, because estrogen doesn't drop in a straight line as we may think. It doesn't go from 500 to 0, right? It takes a period about 10 years to go from 500 to 0. But in those 10 years, it's not a steady decline. It is more like a roller coaster, right? And that's why we have so many different symptoms in perimenopause. And most of the symptoms happen in perimenopause and not after your period stops. So it's like we're almost set to failure during midlife if we don't use the tools that we have available now. If we go beyond medications, hormones, starting to weight lift as early as you can is gold for perimenopause and midlife, right? Entering midlife with a good bank of muscle is going to really redirect how you go through perimenopause, how much you may or not suffer with significant muscle mass. So I think that's like, if you're not entering that stage, this is what can you do right now? Start lifting weights, start getting into the routine of lifting weights, and then your nutrition matters a lot, right? So increasing your protein in your diet. You won't gain muscle if you don't feed the muscle.
100%. I love that. It's just reminded me of your GPS, right? Do you want to maybe just tell the listeners a little bit about, it's a really simple 3-step system to remember.
Yes.
And as we bring this into midlife, again, I know that we talk a lot about GLP-1s because it is never traditionally an obesity medication. Yeah, historically diabetes care, and over 20 odd years, 22, 23 years, right? Previous of data. So it's not a new medication. And in fact, it's not even new within obesity management. When we think about, we have been using it for this, the discovery of it, even in the diabetes care, using it, recognizing that these patients were having such beautiful inflammation reduction and cognitive support. And there's an argument, I suppose, within that we're quite new in the research around. But yeah, your GPS, what is it?
So I always like to simplify as much as I can for my patients, because when it gets too complicated, it's very hard to maintain, right? And the goal here is not just getting to the finishing line, is what happens after the finishing line, right? The GPS is something that I came up in my practice. Is your navigation system, right? We all know what a GPS in your car. It's your navigation system that guides you and takes you to the goal, to where you need to go. So the GPS in my version is the trio that gets you to the body recomposition, right? Because that's what we're looking for, body recomposition and not just weight loss. We have to move away with this sophisticated drugs that we have to start using different, more sophisticated ways of diagnosing and referring to the effects of this medication. So the goal is body recomposition. And to take you there, you need your navigation system, which is GPS, G for GLP-1 medication, P for protein, that's your most important nutrition, and S for strength training. And you have to see it as a trio. One doesn't surpass the other one. They're equally important when you start a GLP-1 medication.
So simple, so easy to think about as well. Okay, so I feel like that really easily segues us into a little bit of a deeper dive discussion then around GLP-1 as part of potential hormone support for midlife women. And again, for anyone outside of midlife, but I really want to just hone the lens in on the menopausal woman, because we know that every single woman born female at birth will navigate a menopause in some fashion or form, whether that be through their own body, like me, a bit earlier or a bit later in life, or through medical interventions. So really looking at it from a point of, as we start to become a bit more aware of these weight loss, or, you know, we are weight loss medications. We have some horrendous names out there. I don't know if it's the same in the US, but we hear a lot of things like skinny jabs. And
I made a post about that today, about how harmful it is to mention those names, to refer to GLP-1 medications as that, right? We don't call insulin the sugar shot, right?
Exactly.
We call it by its name. It's insulin for the treatment of type 2 or type 1 diabetes. This is the same way that we have to refer to GLP-1 medications.
Yeah, I love that you've actually said that. It's a really powerful reframe. And when we start to think about the language that we use, it has such a powerful, or whether that be in a positive or negative light, on how we are perceiving this, because it also brings up the whole elephant in the room sometimes, where people will not even tell anyone that they are, and I suppose terminology wise, using a GLP-1.
There's a lot of shame, right? And it's really unfortunate. And that's the reason that I wrote my book, because I wanna change the narrative. We shame patients for gaining weight. We shame patients for not losing weight. And now we're shaming patients for losing weight from using a medication. It's like they cannot get a break. Either they do it or it's both sides is wrong, right? So by referring to skinny shot, it just adds more stigma, and patients feel more shame, and they're less likely to share their journey, which can potentially help somebody going through the same thing. And what happens when you don't share, you are creating this idea that weight loss is willpower. Because if somebody sees you and you lost 15 kilos, 20 kilos, and they ask you, what are you doing? Just exercising and eating better, but you're really using a GLP-1. That person is going to say, well, if she or he did it the natural way, then I should try, and it should work for me too, right? So we have to, and I talk about this in part 3 of my book, like how to come about having a conversation of being on a GLP-1, or what language to use if somebody you know is on a GLP-1 medication.
There's a strength within this, because even the divide that you can see within the communities of individuals who are choosing that route versus individuals who are not, and the stigma, the shame, the connotation around it being a lazy way, or, you know, an escapism of you're just not wanting to try. So you've then went and purchased this medication. But actually, if we look at the bigger picture in all of this, I remember when GLP-1 first started to be talked about here in the UK, and I'll admit I was really skeptical. Yeah, it's like, oh, here's another medication that's going to do a thing. It's probably not dissimilar to how HRT, hormone replacement therapy for menopause care, was really looked at.
I see the controversy on both of them, right?
Whereas actually, the more and more I got to know about it, and it was difficult to really get true evidence-based information. Yeah. Not one to jump onto the social media platforms and see all the influencers updating on it, but more about where are the true evidence-based, really factual pieces of information that we can even take from, do we have like early emerging even observational studies. Yeah, we might not have the full randomized controlled trials yet, but where are the observationals that we can learn from?
Yeah.
When you had written the book Weightless, that to me was a real big thing of this is on pre-order straight away so that I can read this, and understanding, well, what do we need to know about this drug? Because actually, one of the things I then said to my team was, I really truly believe, and I don't want to use the word predict because it sounds quite woolly, but I really truly believe that GLP-1 medication will become part of menopause hormone therapy by choice for certain women on their journey. And I don't just mean those that meet the obesity criteria through the BMI. Can we chat a little bit deeper on that and understand where this maybe hits the boundaries of it being not off license? So if I was to I said to you, Dr. Salas-Whalen, I am coming to the US in the summer and I'd love to make an appointment with you as an early menopausal woman with osteopenia, and I'm holding belly fat right now that is making me feel a little bit unhappy. Can I come and speak to you about a GLP-1? How would you manage that?
Definitely. First of all, initially, I would do a body composition. So any woman who's listening right now and is thinking, could this work for me? Should I ask about it? Would I benefit from it? Do a body composition. Don't go by your BMI. Don't go by how your clothes fit. Truly know what's what in your weight, right? And if you have high visceral fat, if your percentage body fat is above 28% and you don't have muscle mass, then you have to work on building your muscle, and that you can potentially will benefit with a GLP-1. And that's the reason also of my book is I want consumers to make a decision based on information, education, and science, and not fear. Right. Same thing with hormones. Make a decision of being on HRT and make an educated decision and not something based on fear. So women in midlife can definitely benefit from a GLP-1, and they need to know that this is an available option for them. Whenever, and I tell my patients, more than if it's 5 pounds or 10 pounds, I want patients to ask themselves, is losing weight or maintaining my weight a full-time job?
Yeah.
Then yes, GLP-1 is for you. Because maintaining your weight or reaching a healthy goal in your weight should never feel like it's taking over your life, right? Or to feel like a second job when you already have a full-time job or you have kids at home, right? So you don't have to suffer. You don't have to earn the right to benefit from a GLP-1 medication.
The more and more that I become aware of this, and I do feel very, very fortunate that I'm not in a larger body. I've never experienced what it's like to have obesity. And, it is a disease, it is a condition. And it's beautiful that the World Health Organization have actually now come forward and said, yes, it is. Okay. And I think this is where I've heard you say previously across posts and in other podcasts as well, that we owe a massive apology. Yeah. And I feel like it's like a central theme right now for just women's health in general. I don't just mean, within obesity, but it's across centuries of just non-research, no understanding along some of the women's health areas that we have. And actually, where GLP-1 comes into this is it could be something that really supports women metabolically. So having that support cardiovascularly, with our cardiovascular health declining and becoming a lot more at risk and problematic in later life, especially postmenopausal. These are just things we don't want to muck about with. And if there is something that can help us and we start to learn and know more about it, I am all for that.
We have to remember, and I think that here's where the hesitation comes, is like, oh, I'm just going to take a shot and I'm going to lose weight. Well, no. Actually, there's a lot of work to get to the right result, which is body recomposition. Because what I care in somebody's weight is what's going to make you unhealthy, what increases your risk of disease, and what's going to make you healthy, right? So do I need to reduce your risk of disease by reducing body fat and increasing muscle mass? So that's what you need to remember, that that's the goal. It's not just fitting on a dress, and that comes the GPS. It has to be the nutrition. There has to be the weightlifting. And I think if women and people acknowledge that, it feels less as the easy route, as the cheating part, right? Because you still have to be involved. 75% or 60% of the treatment is what you're going to do at home, right? The other percent is going to be the medication, but the medication is never the 100%.
It brings up for me just in this moment a reflection around, I was born in the early 80s. I grew up in the time where it was all very Kate Moss, nothing tastes as good as skinny feels era. Yeah, I know, it's brutal. And I'm a mum to twin girls. They're 15, so they're very in that space of body changing, and they hear me and the language that I use as well. And I just think that it's so important that when we think about that, the whole perception of weight loss, fat loss, those are two separate things entirely as well. But where you reframe this even further is to say this isn't about fat loss or weight loss per se. It's about body recomposition. It's about looking at how healthy is our muscle volume, our skeletal health. All of these things really matter. And as a positive psychology expert as well, I go further than that to look at, again, how can we bring happiness into that? It is our birthright. And if you mentioned beautifully about if this becomes a full-time job for you and you feel like you're constantly just every day recycling around the same fears and worries and anxieties, then please don't speak to someone. And a beautiful chapter section you've included in your book is about how to get the help and how to choose your relevant provider as well, which is really supportive.
I think one of the most important things in a GLP-1, first is deciding that you want to be on a GLP-1. And the second is who you're going to choose to walk you through this journey. Who you choose and the expertise that this provider may or may not have is going to determine success, failure, and safety of the medication, right? So that's why I made that checklist on what to ask when you're calling to make the appointment. What are the green flags in a provider? What are the red flags of a provider? Or even if you're doing it via telehealth, there's still ways that you can get the adequate telehealth help. Or I tell the readers, use this book as the information that may be lagging from the telehealth company, right? That they can still have healthy success, even if they're doing it through telehealth.
Now, you are a super busy woman, and I understand you have a full clinic to go and see to today. So I have just one more question before we finish up today. If we fast forward 5 years from now, how do you think GLP-1s will be positioned in women's health?
You have to understand, I've seen 15 years of this medication out in the wild.
Yeah.
And it had to take COVID, the pandemic of COVID, to bring attention to obesity and to bring attention for the treatment of obesity, right? We had an understanding of what obesity does to the body and its chronic inflammation, right? And because your immune system is fighting that chronic inflammation, came a virus out of nowhere, and the patients with obesity were the ones with higher mortality or got more visits to the intensive care unit, right? So we got it. We understood that obesity, it could be at any moment. It's not in 20 years that you develop type 2 diabetes or do you develop osteoarthritis. It can happen at any moment because your body is fighting the fat, right? Or it's just increasing your inflammatory points. So it had to take that world event that impacted every person to start understanding and learning about GLP-1s, because we've been using it for 10 years before that happened, right? So I think in women's health, they're very parallel what's happening in obesity and women's health, because now we understand the safety of hormones, right? So now we understand that we can use them safely, that we don't have to suffer through perimenopause, menopause, that more women than not meet criteria and benefit from hormone replacement therapy. So I think we are opening our view of of what we can use at the moment to help us live a better, healthier life or higher quality of life, which that's what matters the most. So I think opening the door to hormone replacement therapy, we're also opening the door for GLP-1 medication. If there is such thing as a perfect marriage, I see it as hormone replacement therapy and GLP-1 medications.
Oh, I'm so pleased to hear you say that, because it literally is something that as we find out more around and we look at the improvements that we can have, and even just in the emerging research, we've had a study come out around menopause and grey matter reduction in the brain, but white matter adaptation that we can have. Again, it's as we research more. I mean, the psychology space is like my geeky zone. This is the part I love to get into. So as we hear more about cognitive enhancement or support, that for me is just like, we can't muck about with that. This is so, so big. And as we start to see more and more, hopefully, again, emerging research, even by the latter part of this year, we're recording this at the start of the year, and by the end of the year, I'm excited. I'm excited to see where we'll be.
I think in the next 2 or 3 generations after us, we will see really the impacts of GLP-1 and hormone therapy.
Dr. Salas-Whalen, thank you so deeply for saying yes to come and speak with us. I know you are mega busy right now, and we feel super honored that you have come and joined us on the Menopause Coach Podcast. I appreciate you.
Thank you so much for having me. And waitlist is available in all the UK.
Yes. So on that point, where can the listeners find you, and where can they order their copy? Because you have the UK version available and you have your US and Canada version available as well. And I can vouch, it is a brilliant read.
This is the US cover, and then this is the UK cover. So you can get it anywhere you buy books, Amazon, anything online that you buy a book, you can find my book there. And they can find me on social media and Instagram, and I post a lot of what I write in my book and what I practice in my office is at Dr. Salas-Whalen.
What I hope today's conversation has made so clear is that midlife women deserve far more than just the narratives that we have historically been given around everything, not just weight loss or body recomposition, but everything in women's health. I also want to highlight as well that this is not about willpower. If anything, and you've taken that away from today, then it's a thumbs up. It's certainly not about just oversimplifying very complex metabolic shifts into these calorie equations of you want to lose weight, then you just move a bit more and eat a bit less. We're far from that now. Let's not stick with that narrative any longer. This is about understanding that perimenopause and menopause really truly represent a profound physiological transition for us as women. One that has this intersection with insulin, signaling, inflammation, body composition, as we've heard and we've talked about today with Dr. Salas-Whalen, cognitive changes, long-term cardiovascular health. It is vast. And GLP-1 medications are part of that evolving conversation, as you've heard today. Not as a magic solution or a shortcut, but as a potential tool in your toolbox that you get to decide and look at in a broader, personalized, very evidence-based way for you and your body. And this field continues to evolve, and that's exciting. I think we're only just beginning to understand how metabolic medicine and menopause combined in care may integrate in a more sophisticated way moving forward. And I did make a prediction at the start of 2025 that, and I will stand by this, that for many women, GLP-1 receptor agonists, so GLP-1s, and hormone replacement therapy or menopause hormone therapy are going to become this beautiful marriage, this beautiful integration for many women, and not just in the line of obesity management. As always, anything shared on this podcast, especially during this episode today, are the views of the guest and myself. This is not meant to replace any medical or any guided medical support, please always make sure that you consult your own medical team moving forward for your care needs and not making this episode your medical guidance. I have a feeling that this conversation that you have just heard today, it's far from finished. So if you've enjoyed this, you know what to do. Go ahead, make sure you're subscribed so you can get all of the latest episodes into your notifications in your mailbox. And until next time, please do go share this with one other woman in your life. It is so important that we reach as many women as possible and share this vastness in the collective energies so that each and every one of us continue to elevate and rise into the purpose and powerful sovereign women that we truly are in our core, in our energy core. I love being here with you every week. So until next time, when we will be coming back with more for your menopause, your health, your advancement, your success, all the topics, nothing is off limits. Drop in and let me know what you've made of this episode. And you can email me, Adele at adelejohnstoncoaching.com, anytime you want to chat through anything in these episodes. But do make sure you go subscribe, and I will see you in the next episode.